Thank you all for coming. It's absolutely amazing to see you all here from every corner of Ontario to show your support. It is absolutely phenomenal. Welcome to our Queen's Park rally on behalf of Concerned Ontario Doctors. I'm Dr. Andrew Liu. Thank you. I'm Dr. Andrew Liu from Concerned Ontario Doctors. Now, when this all started, I wondered if this may be like cuts in the past. Some aspects may suffer, but maybe we'll work through it. It was not long until I looked around and saw that clinics were closing, ORs were being shut down, and doctors old and new were leaving the province like never before. Over 1,200 nurses have lost their jobs and counting. Over 50 residency spots have been cut. Nearly 1 million Ontarians still don't have a family physician. ERs are overflowing and people are dying on wait lists. In September 2015, a grassroots advocacy group called Concerned Ontario Doctors formed to take on the government against their reckless cuts. We have tracked and verified the impact of the unilateral actions on physician practices across Ontario. Alongside our patients, we have written hundreds to thousands of letters to newspapers, MPPs, Eric Hoskins and Kathleen Wynne. We have thousands of names submitted on petitions. We have posters and videos discussing the impact of the cuts. We had a day of action on October 21st, 2015, right here at Queen's Park. We held a vigil for the Paris attacks in November. We had a rally in Whitby, Oshawa that showed healthcare was a priority, eventually swinging the election. We are over 11,000 doctors strong on Facebook and growing. Our outreach on our public Facebook site is nearly 10 million and growing. We've been on radio, TV, and countless newspapers in addition to flooding social media. We are gathered here alongside you, the public, the patients, to show this corrupt government that they cannot cut health care at the cost of patients. Thank you. So in addition to hearing from me, you'll also hear from Dr. Mark Linder, another member of Concerned Ontario Doctors, as well as from our leaders, Drs. Nadia Alam and Kulvinder Gill. You'll hear from patients who will share their stories. Lisa Hamilton, Chris Cull, and unfortunately patient Janet Hussey cannot make it, but Dr. Sohail Gandhi will speak in her place due to an emergency. We have the honor of being joined by members of Parliament, PC Health Critic and MPP of Elgin-Middlesex-London, Jeff Yurek. Deputy Leader of the NDP and MPP of Bramalea-Gormalton, Jagmeet Singh. And PC Health Leader and MPP of Simcoe North, Patrick Brown. Later, we'll also have a moment of silence for Laura Hillier, who has unfortunately died on a waiting list due to these government cuts. Following the speeches, there will also be media interviews and subsequently a march around this area, which will go from east on College, south on Bay, west on Dundas, and north on University at approximately 1:30 to 2:30. If you haven't grabbed a sign, feel free to help yourself. We've got hundreds of them. Porta potties are just to my right, your left. We have lots of bottles of water in case you're thirsty. Just come, help yourself. The police will be accompanying us along that march. At about 2:30 to 3 o'clock, we'll have closing remarks. Now make no mistake, we're in a crisis, we're in a war. We didn't start it, but for the sake of our patients, we will finish it. I'm not an activist, I'm not a politician, I'm an Ontario physician, and I refuse to stand by and watch while the Ontario government destroys healthcare to pay for scandals and bureaucracy. Let's fight for our healthcare together. Thank you. Thank you, Andrew.
Hi, my name is Mark Linder. I'm a family physician here in Toronto. Thanks for coming.
Thank you.
Kathleen Wynne's government is cutting healthcare. They're doing this recklessly, and they're doing this willfully. Over the past 4 years, the Liberal government has steadily decreased hospital funding so that nurses, as you heard, across the province are being laid off, and operating rooms are sitting open with no funding to pay for surgeries. They've barely raised the physician services budget, a budget that pays for patient visits. And when more patients access the system than the budget can handle, physicians are told by this government that they are out of control and in some cases are having their fees clawed back. So, not surprisingly, we are now dealing with unprecedented levels of physician burnout across this province. Multiple physicians are retiring earlier than planned because of ongoing abusive treatment at the hands of this government. Recent research targeting family medicine residents have shown that the vast majority are now planning on leaving the province to start their practices. Why? Simply put, the Liberal government is not only failing to fund our healthcare system and bargain in good faith with the physicians, they are actively and publicly blaming physicians for the healthcare crisis that they themselves have precipitated. In 2012, the government asked physicians to freeze their fees. Back then, we accepted it. We saw that times were hard and everyone needed to do their part, and we did. Despite increasing costs, we agreed to have our fees frozen. But as it turns out, that was just the beginning. The government, year after year, relentlessly increased their cuts to healthcare. And when our representative organization begged them to come back to the table, to negotiate reasonably, to recognize that cutting physician services would have dire consequences to the health of our population, they turned their back. In 2015, the cuts spiked exponentially and the tipping point was reached. Now medical offices all over this province have started shutting down. Multiple physicians are retiring early with no one to replace them, and new physicians are choosing to start their practices in different regions. I'm a family physician in downtown Toronto. Every single day my office is inundated with phone calls of desperate patients searching for a doctor to look after them. And every day I'm faced with the question, should I spend a little less time with my current patients so I can absorb just a few more? How much longer can this go on? The population of Ontario is growing at 140,000 per year. That's 140,000 new people each year that need and deserve access to our healthcare system. Our population is aging. That means a growing population of seniors who, by virtue of getting older, need more intensive healthcare management. It is the responsibility of the Government of Ontario to fund this healthcare appropriately, but they are recklessly and willfully shirking that responsibility. Thank you.
Yesterday, Health Minister Eric Hoskins held a press conference to speak to frontline doctors in Ontario. Many found his words disrespectful, divisive, manipulative, infuriating. Why? Because physicians saw the political spin for the desperate lie it was. Lies perpetuated by the Ontario Liberals since January 2015 to justify their reckless unilateral actions. Let's confront these lies head-on with some honesty. Ontario's physicians are not the best paid in Canada. They haven't been for a long time. The Liberals are twisting the data to serve a hidden agenda. Per patient, per service, per procedure, per visit, Ontario's doctors are among the lowest paid. We know this. We have always known this. We are not in this for the money. We never were. We exist to care for our communities. We see a ton of patients. A lot of the billings that generates pays for overhead. Some of us pay very little. Most of us pay many thousands of dollars per month in overhead. The examining table you sit on, the computer, the secretary who greets you, the nurse who educates you, the lights, the heat, the rent. A few of us pay tens of thousands of dollars per month to take care of our patients. Special equipment like visual field scanners, slit lamps, EKG machines, echocardiograms, x-rays, ultrasound, as well as the technicians who to run these machines, who service and upgrade them. This is not a small thing. Office overhead in some community clinics can be as high as 75% of billings, and none of it is government subsidized. One doctor told me he will die in debt. I asked him, what do you mean? He said, I do this to take care of my patients because the government will not. He said, we exist to serve our communities. The physician budget is not out of control. That is just ridiculous. Every year, more people come to Ontario, more get older, more get sicker, more need health care. Doctors serve more families in Ontario year by year. Traffic gridlock is caused by more cars. Healthcare gridlock is caused by more patients. This need for physician help, for physicians' care, drives the budget up. In the past 4 years, the physician services budget grew by 2 to 3% per year. Let's put this into perspective. The energy sector employees had a rise in their budget of over 11%. Hospital administration got an increase of 7%. The ministry sector payments rose by 7%. So no, Eric Hoskins, care by physicians is pretty darn cheap compared to everything else the Liberals are willing to fund. This government is more interested in funding bureaucrats instead of beds, doctors, and nurses. That is why negotiations failed between the OMA and the Ministry of Health. Eric Hoskins wants to fund not even half the care Ontario needs. Doctors in Ontario will not accept that. Hoskins lies when he says doctors don't care. We do. Again, we exist to serve this community. What happens when you don't fund enough care? After 8 years of making do with less, Princess Margaret Hospital, our internationally renowned cancer hospital, finally went into crisis. They can no longer afford to provide the standard of care treatment for leukemia. They asked chemo patients and their caregivers to go down to the States to get the care that OHIP should have covered here. I get that OHIP shouldn't cover cosmetic procedures, but I'm terrified when OHIP can no longer cover life-saving cancer treatment. We have no other health insurance in Ontario. OHIP is it. What do we tell suffering patients when their government will not fund life-saving treatment? The ministry keeps framing this as an issue about physician income. Every time we say patients are getting hurt, they yell, "High biller!" So here it is. I asked a bunch of those so-called high billers late last night, what does it take to do what you do? For an ophthalmologist, it means taking out a business loan of $6 million to set up a retinal surgery clinic because the hospitals can't afford it, because the government won't fund it. He works 6 days a week, sees 120 to 130 patients a day, 28,000 a year. He starts at 7, comes home at 8. He does this week after week, year after year, because he is the only retinal surgeon serving 3 cities. He did this even though the Ministry of Health cut his fees by 50%. I said to him, you can't humanly continue this pace. He said, if I stop, patients go blind. This is the burden of care that physicians gladly shoulder. We exist to serve our communities. Here's another story, a neurosurgeon this time. He works the same caseload as 3 American neurosurgeons and he's paid less than them. He works 72 to 110 hours per week. 30 new patients each and every day with brain tumors, aneurysms, paralyzing spinal cord disease. He doesn't get to put his young daughter to bed. You can't sustain this, I said to him. If I stop, these patients die or are paralyzed, life or limb. We exist to care for this community. Here's another, a radiologist, a young mom. She works from 8 a.m. to 5 p.m., grabs a quick dinner with her kids, then works another 5 hours. A double shift every weekday. And then on weekends, she puts in another 5 hours a day. She worked 360 days last year. She has generated 30 to 40,000 reports for 30 to 40,000 patients. What does that mean? The images she analyzes tell her stories. Stories of cancer growing in a woman's breast, bowel that have ruptured, knees brittle with arthritis. She took a week off from mat leave and even works while breastfeeding her baby in the middle of the night. You can't keep this up, I said. I can't stop. We exist to care for this community. The final story I'll touch on, an obstetrician this time, the only one serving a city of 70,000. He works 7 days a week, delivering 300 babies a year and has done so for 35 years. This man is 70 years old and he works 70 hours a week. He does it because he loves his patients. Again, we exist to serve our community. These doctors are workaholics who have sacrificed all semblance of a normal life to martyr themselves for their patients. Life or limb. That is why there are only 500 of them. 1% of all doctors in Ontario work like this. The government has already audited these doctors and found nothing wrong. So why are they making such a big deal? These are the doctors that Hoskins and the Liberals publicly shamed yesterday. Each of these doctors do what they do to care for and serve the people of Ontario. What happens to patients when the ministry lies? They suffer on wait lists. They die on wait lists. Wait lists exist because supply does not match demand. Plain and simple. The supply of healthcare, of doctors, of nurses does not match patient need and patient care. What happens to doctors when they hear the ministry lie over and over again? They hurt. They become cynical. They burn out. Out of nearly 1,000 doctors surveyed by Concerned Ontario doctors, 40% said they are working harder. They are working more without seeing any benefit to patients. 78% said they are burning out. This is worse than the national average of 40% in physicians. We exist to serve our communities. But we are in trouble. This is not a physician income issue. This is a government priority issue. This is a patient care issue. This is why we need your help. We exist to serve you. We need you to tell the Ontario Liberals to step up and do their job, just like we do every day.
I am standing here today as a Concerned Ontario doctor. The last time doctors rallied at Queen's Park was in 1986. What brings us back 3 decades later? Wynne and her Liberal government have recklessly cut funding to your health care. These cuts are thoughtless, short-sighted, and harmful to our patients. What is the result? These cuts have created less access and care and longer wait times. I know because my colleagues and I have tracked, verified, and mapped out the impact of these cuts across the entire province. It has left the most vulnerable of patients without the care that they so need and deserve. And that is why, 30 years later, thousands of doctors cannot be silent anymore. The nearly $1 billion in cuts to physician services have forced many physicians to close their clinics, to relocate, or to retire earlier than planned. Since October 1st, 2015, changes in 116 family doctors' practices and nearly 100 specialist clinics have affected the access and immediate care for nearly 100,000 Ontario patients. As of now, 1 million patients in the province are without a family doctor. The last time the Ontario government cut so deeply was in the early 1990s, when nearly 3 million patients lost their family doctor. That's 1 in 4. Where will these patients go for care? With walk-in clinics forced to close, orphan patients have no choice but to flood emergency rooms. Not surprisingly, ERs in Toronto and the GTA are unable to handle the massive patients seeking care. It scares me that seniors are parked in ER corridors for days simply waiting for a hospital bed. This indignity and lack of respect for our seniors who have spent a lifetime contributing to our healthcare system as taxpayers is completely unacceptable. Sadly, this isn't the only group the Liberal government is failing. You'll soon hear about the impacts to complex care patients, to children, to addiction patients. The same is happening in palliative care. Palliative care in Ontario is largely provided by family doctors. Because of these cuts, several communities are no longer able to attract new family physicians because the ministry refuses to designate them as underserviced. Because of the growing wait lists for palliative care beds, many physicians perform house calls so that their patients can die peacefully at home. Over the past few months, several local physician groups in Windsor region and the Port Perry area have been denied government funding to be able to fully provide this necessary service for their patients. Meanwhile, St. Joseph's palliative care program here in Toronto was completely terminated. Think about it. Patients are dying without access to a palliative care doctor to manage their pain and suffering. Because of financial mismanagement, the Liberal government has solely been responsible for the rescheduling or cancellation of hundreds of medically necessary surgeries across the province. Patients who had been waiting 8 to 12 months for their surgeries were told to wait another 6 to 8 months until the middle of the next budget year. Shameful. This is true for cardiac surgery, obstetrics, orthopedic surgery, and cataract surgery in hospitals all across the province. Surgeons and nurses are standing by, but the lights of these operating rooms are off because the Liberals are too busy paying down their scandals rather than for your health care. We must stop this roller coaster approach to healthcare. We need stability. We need the provincial government to properly fund and work with physicians to reform healthcare. Otherwise, more patients will die waiting on wait lists, like Laura Hillier, a young Burlington teen who was battling leukemia. She was a passionate young advocate against long wait lists for stem cell transplants. Her family recently shared how her treatment was met with delay after delay because of lack of funding for beds and staff. I want to share what she wanted all of you to know before she died. They said I may not wake up, but I really hope I do. But if I don't, I hope this never happens to anyone ever again, and that the government sees that there needs to be funding, because people are dying when we can save them. Please help. I pray that this family's tragedy doesn't fall on bureaucratic deaf ears. These cuts must stop before another life is claimed. Our government has two provincial mandates: healthcare and education. Healthcare impacts every single citizen at every moment in their life. The Liberal government needs to stop with the smoke and mirrors. They need to stop with the lies and spins. Human lives are at stake. They are utterly failing at their obligation to fund our health care. Never before have doctors marched in protest with the public down the streets of downtown Toronto. Never before has Ontario's healthcare system been so eroded from chronic underfunding to such a degree that patient well-being is at stake. We are saying enough is enough. Our patients deserve and need better. Ontario's doctors have no choice but to sound the alarm.
Good afternoon. My name is Lisa Hamilton, and at the age of 7, I lost the hearing in my right ear to an infection. In 1995, I was diagnosed with fibromyalgia. In 2008, osteoarthritis. In 2010, I underwent spinal surgery to relieve unspeakable pain. In 2012, I was diagnosed with celiac disease. In 2015, I had an accident which ruptured my left eardrum. my only hearing ear. It did not heal. And in 2016, I hadn't had a family doctor for almost 5 years. My mother passed away late December 2014. My sister and I spent so much of that year in hospital and emergency rooms with Mom. Too often, we begged the hospital not to discharge her, knowing that she would be back, often in only days, only to be readmitted via emergency, where she repeatedly spent days on a gurney with barely a sheet, waiting. My grandson turned 6 this February. He's such an amazing little boy. But he's had some problems at school, so his teacher recommended he get tested. So we waited, and we waited. Tyler was diagnosed with autism, now too old to qualify for special treatment, despite our wait. In January 2012, I moved cities. Needing a new local doctor, I enrolled in Healthcare Connect, the Ontario program that links patients with family doctors. Now, in order to register, you must first de-roster with your existing physician, and not doing so would make me ineligible. However, given my medical history, I was assigned a priority designation. So with little option, I de-rostered, enrolled, and waited. I waited for over 4 years without a primary care physician, with only the services of an overcrowded and overwhelmed emergency department and walk-in clinic to rely on. Today, over 1 million patients in Ontario are waiting for a family doctor. Yet, instead of assisting our new family medicine graduates start their new practice, they are burdened. So heavily, in fact, that only two out of hundreds of graduates even signed the new entry graduate program. And in a recently done study, it showed that 67% plan to leave the province. I fear for our future. I'm afraid to get older. I'm afraid to get sick. Not because I fear the pain or the suffering, but because I fear that I will be alone in my medical future with no doctor who cares. Forgotten and unimportant. Too sick or too old. It's time we stop waiting and stand together with our Ontario doctors and demand care, not cuts. Thank you.
Hello, everybody. My name is Chris Cull. I'm 31 years old from Bowmanville, Ontario, and I'm the founder of Inspire Canada. I'm just going to get right into the thick of it. When I was 22 years old, my father took his own life after a battle with Huntington's disease. And as I wasn't emotionally nor mentally productive enough to developed enough to handle it in a productive way, I turned to using Percocet to kind of help cope and numb it out. That quickly escalated into using 580 milligram Oxycontins a day for 2 years. And then after a struggle with trying to go cold turkey, I decided to go on a harm reduction program. And over the 5-year term, I went 2 years without gas, up to 4 days without eating in my home. Then I met my amazing doctor, Dr. Marnie Brooks, who's right over here to the right of me. And what she did for me was taught me about personal accountability and gave me the tools to develop the integrity to understand when I'm hurting myself or hurting others. So as a good just to pay it forward, I got off methadone back in January 2014. So then I decided that I had seen so much over those 8 years that I got curious as to see what it's like across the rest of the country. So in 2014, I rode a bike across Canada from Victoria, BC to St. John's, Newfoundland, and literally stopped in every single town that I slept in across the country and went out and documented stories to highlight how bad this problem has become. And in 2 weeks' time, I'm riding a bike across Canada again to raise awareness about mental health and addiction. But what I found across the country is that there are people on waiting lists. And in my personal experience, timely treatment without waiting periods is the difference between life and death. It's the difference between somebody who is in my position thinking about going and robbing a pharmacy versus going to work and being a productive member of society. It's resulted in the closing of several clinics, and by cutting funding to a problem that needed additional funding before the cuts to begin with, you've given those who are struggling, as well as their families and friends and loved ones, a complete lack of hope that things can get better. As someone who is a result of these programs, I'm completely appalled by the lack of foresight that went into this decision. So in closing, my promise to you is I will use my platform when I am across the country this summer to bring attention to these unacceptable budget cuts. At the end of the day, regardless how you view addiction or mental health, people are dying out there, and that's no joke. So let's all work together. We'll keep our voices strong and loud enough until changes are made. You never know how close you are to success until you finally achieve it. Thank you for having me, and never quit.
Hi. First, I want to thank everyone for coming. It's very much appreciated by all the frontline physicians that so many non-physicians have attended this event to support us in our cause. So thank you very much for that. This is a statement from Janet Hussey that I'm just going to read out for everyone. And I think you'll see from the statement that she has very good reason for not being here. Hi everyone. I am so disappointed that I'm not able to stand... Oh, sorry. Hi everyone. I am so disappointed that I'm not able to stand with you today. My husband, who suffers with cervical and lumbar stenosis, is waiting for a date for surgery. He has been in tremendous pain the past few days, and I'm not able to leave him. Dr. Hoskins, Kathleen Wynne, my husband is one example why care not cuts hurts all of us. Listen to the patients and the doctors in the province. We deserve better. Sincerely, Janet Hussey. So I'd like to thank Janet for her statement.
Good afternoon, everybody. Thank you for being here today. I'm sorry you have to be here, but because of Kathleen Wynne and Eric Hoskins making cuts to the healthcare system, it's forcing you to stand up for your patients. So thank you for being here. Our party has stood on the side of healthcare professionals since day one. 8 months ago, when the government began the cuts to healthcare, $800 million from patient care directly, we stood here with the concerned doctors of Ontario for a rally day. We brought forth a bill, our leader Patrick Brown, a motion to reverse the cuts. And this just showed the respect that the Liberal government has for doctors that day and healthcare professionals, is when it came to vote for that motion, the health minister was at a Blue Jays game. Ontarians deserve better. Our patients deserve better. This government has turned arrogant. This government is disrespectful. This government is becoming a bully. And what do you do to bullies? You stand up to them. Yesterday, Eric Hoskins said, and I'm going to paraphrase him, the Liberal government has wasted billions of dollars on gas plants, on e-health, on Orange, and the fault is the doctors. That is wrong. It has to stop. It has to stop now. We want to stand together in solidarity, not only with doctors, because this isn't just about doctors. This is about the sustainability of our healthcare system. We stand with doctors, we stand with nurses, with pharmacists, with physiotherapists, but most of all, the Ontario PC Party stands with Ontarians for sustainable healthcare. Again, I want to thank you for being here today. It's a pleasure to stand with you, and believe me, we are not going to stop. We are going to question the minister every chance we get to take another look at his mistakes. He's got time to make up for it, refund the cuts he's made to healthcare, and ensure patients have access to quality healthcare. Thank you very much.
And I should mention we have here today as well MPP Lorne Coe from Whitby, Oshawa, another proud supporter of Ontario patients. Thank you all for being here today. Thank you for taking the time, from physicians with busy practices to sacrifice your day off to be here to protest. Thank you for standing up. To patients, to the patients who had the courage to speak today, to say what is happening, how it's wrong, I say to those patients, thank you. And I want to say what I saw yesterday as I watched the press conference of Eric Hoskins. I was angry because it was political spin. It was dishonest. He's trying to pit doctor against doctor. He's trying to mislead the public. He is trying to muddy the waters. You know, when they have Eric Hoskins' salary on the Sunshine List, they don't include all his support staff as part of his salary. And that's what he's trying to do. When he puts out the list of salaries and doesn't talk about overhead, doesn't talk about staff, it's misleading. It's dishonest. And I don't think we need a health minister who's going to demonize doctors. I want a health minister who says to doctors and nurses and physiotherapists and every healthcare practitioner that we value you, that we respect what you're doing. Because I know from every healthcare worker I have met, everyone working in the system, that they break their backs, that they're in it for the right reasons, that they have devoted their life. And some of the education training that's required is extraordinary. But they have devoted their life to help. They have devoted their life to patients. And to see a health minister go out and attack them, it's not right. And that's why I'm here today, because I want to tell the other side of the story, not the government spin machine. The other side of the story is this. There is 140,000 new patients a year. And last year, no matter what they try to say, they cut healthcare by $54 million. If you look at the federal transfer, they actually took $54 million out of the health budget. And to pay for their bureaucracy, to pay for their health ads, by the way. Have you heard that they're playing radio ads right now saying they're doing such a great job? Vanity ads. And I said, maybe instead of radio ads, you could put that into patients. Maybe you could put that into physicians and to nurses. But here's the cold, hard facts. $815 million has been taken away from physicians, which means you're taking it away from patients. The reality is they have taken over 2,000 children off the list for autism. Everywhere you go, you're hearing about another health cutback. $50 million out of physiotherapy. And I can tell you, everywhere I go around the province, I hear a new story. A few weekends ago, I was in Windsor. $20 million cut from their hospital. They can't sustain it. I was in London with Jeff Yurek, and it was millions, $6 or $7 million out of the local hospital. In my riding in Simcoe North, in Georgian Bay General, I see there's a sign, Save the Midland Hospital. The government is taking $5 million out. The obstetrics program gone. And by the way, Midland is an area that serves both an Indigenous population and a Francophone population. And the government said they were going to try to enhance care in that area. And what we're seeing is it's all lies. It's the opposite. They're actually cutting those services, that care to vulnerable communities. So I thought today, one thing I could share with you is a few of the stories, a few of the real patient stories that we've been hearing, the letters I've been getting from my office. And I wanted to share a few of those with you today. I heard from a woman named Lynn from Sarnia who had a spinal surgery after 2.5 years on the waiting list. On top of this, the surgery was done in London because Sarnia does not have the resources due to lack of funding. Now she has another problem with her back, and she's trying to get another appointment in London, but we've been advised it takes a year to reply to request just to get an appointment. Not to get an appointment, to get a reply. This is supposed to be Ontario, where we're proud of our healthcare system. But this is the consequence when you cut and you cut and you cut, and you have a health minister that attacks nurses and doctors. That service that you need, when you need that surgery, it's not available. You know, I heard another story, another letter from Grant, who lost the love of his life after a 3-month fight with lung and bone cancer. Although Grant said the frontline staff were fantastic, were incredible, and they did their very best, there wasn't enough staff available to properly care for his wife. It was extremely difficult to watch her struggle in pain for hours, waiting for appointments, and even once waiting in the ER for 8 hours. They continued to ask for a hospice bed, but they waited and waited while she suffered. None were available until 3 days before she passed away. Shameful. You know, just a few weeks ago, I received a letter from a resident of Uxbridge, Tia Riopol, describing the positive impacts that IBI therapy had on her young daughter, Jolieanne Jones. The email said this: IBI therapy dramatically improved her communication skills, giving her the ability to make eye contact, to finally make friends. After 6 months of IBI therapy, Jolieanne acknowledged her grandfather's presence for the first time by giving him a hug. You know, how beautiful is that? But now the government has decided that anyone over the age of 5 doesn't qualify for IBI treatment. And so I have a message for Kathleen Wynne on this latest cut to health services. Autism doesn't end at 5. And I wanted to say to you very clearly today that the Ontario PC caucus, we will continue to fight on patients' behalf in the legislature. And it doesn't matter what they held back, because you wouldn't believe it. If for those doctors who were here the day we had our motion, when we were saying you have to reverse the cuts, and we were saying this isn't right for patients, you know, Deb Matthews and Eric Hoskins had the dossier yell back, you only care about rich, spoiled doctors. And I'm thinking, how disrespectful, how insincere, how wrong. People breaking their backs with huge overheads just to care for patients, and they look down at them. And by the way, when they gave the new CEO of Hydro One a $4 million salary, 10 times that of any other comparative CEO, they weren't talking about salaries. They have priorities. Their priority is bloated bureaucracy, it's scandal, it's waste, it's mismanagement. Their priority is not healthcare, and it is disgusting, because Ontarians expect us to care about healthcare. Ontarians expect the government to value healthcare. And you know what I have in my office as a reminder of how fundamentally important healthcare is above my desk in my office, just to our left, is I have my late grandmother's volunteer certificate. You know, she was a blue coat at the Royal Victoria Hospital in Barrie for 45 years, and she hung it in her kitchen with pride. And when she passed away, I said, I'm going to take this as a memory, and I've had it in my Ottawa office and now my Queen's Park office as a reminder that just like my grandmother cared more than anything about supporting her local hospital, that's how we all feel. Hospitals are the bedrock of our community. Physicians, nurses, you are the ones that make our province amazing. And that's why I say to Kathleen Wynne and Eric Hoskins, care, not cuts. And when you cut $815 million from physician services, we say that's wrong. When they cut 50 medical residency positions, despite having 1 million Ontarians who need a family doctor, we say that is wrong. When they cut $20 million from assistive devices program for patients, we say that is wrong. 9 consecutive years of funding cuts to hospitals, 4 years of frozen budgets, that is wrong. And Eric Hoskins and Kathleen Wynne can ignore us. But I can tell you the public in Ontario isn't. You know, they tried to ignore what they're doing in Whitby, Oshawa. You know, Lauren Coe's from Whitby, Oshawa, and Lauren said, I'm going to stand with doctors, and we'll see what happens at the ballot box. I'm going to stand with patients, and we'll see what happens at the ballot box. You know what happened a few months ago in the by-election in Whitby, Oshawa? Lauren, despite Eric Hoskins and Kathleen Wynne practically living in Whitby, Oshawa for 2 months, Eric Hoskins, we should thank him, shouldn't we, Lauren? Because Eric Hoskins is responsible for Lauren Coe having one of the largest victories in 25 years. And so they can say their spin. They can disparage doctors. They can spread their dishonesty, but the public isn't buying it. Because I know if you ask 10 people walking down University Street and you say, who do you trust? Do you trust our doctors or do you trust Eric Hoskins? They're going to say care, not cuts. They're going to say we trust our doctors. So I'm here today to say unequivocally, I stand with doctors. I stand with patients. The Ontario PC Party is by your side, and mark our words, we will not stop fighting. We will not stop raising this in the legislature until we have a government and a health minister that appreciates and values healthcare, patients, and doctors. Thank you for being here today.
Thank you, Patrick Brown. So I just wanted to take a moment before we start our march to thank all of you for coming and supporting Ontario's doctors and fighting for healthcare together. I wanted to take a moment to remember the patients that couldn't be with us today. The patients that are suffering, waiting on wait lists. The patients that are suffering, waiting for treatment. The patients that are dying, waiting for treatment. If you could all please join me for a moment of silence as we remember these patients that we rally for today, these patients that we fight for today. Thank you.
How's everyone feeling today? This was an amazing show of strength. What do we want to say to Kathleen Wynne and the Liberals that did exactly what you just said? Scandals, no. Healthcare, yes. So is this the government that we thought, is this the Kathleen Wynne that we thought people voted for that would cancel or cut healthcare? Is this what you expected? Is this the right direction to go? Do we need to be cutting our healthcare? What we need to do is invest in these essential services for our community. We need to invest in healthcare, is that right? We need to support our frontline care providers like our doctors, like our nurses. So the thing is though, this isn't a coincidence. If you look at the Liberal government, their strategy has been very consistently to cut. They're cutting services when it comes to nurses. I know how many people are nurses here. Can they say, are there cuts going on for nurses? Absolutely they're going on. The Liberals deny that. There's cuts to healthcare going on. Now, here's something that I think is very troubling. The government says that they've invested in healthcare. Their investments are less than the rate of inflation. Now, to me, I'm not the best mathematician, but if the rate of inflation is higher than the amount you're investing, that's not an investment, that's a cut. There's been consistent cuts to healthcare over the past 5 years, and we need to make sure that's clear when the Liberals say in their budget, oh, we've invested in healthcare. If you're investing less than the rate of inflation, that's not an investment, that's a cut, and then truth needs to be heard loud and clear. So another issue is that the government seems to find money when it comes to $1 billion wasted on e-health, $1 billion for replacing gas plants that were never built, for Orange, which was mismanaged and, colossal waste of money. But when it comes to providing frontline health care, there seems to be no money. That seems to me to be a lack of prioritization of what we need in this province. It's very clear that this government doesn't get their priorities straight, and I'm so honored to be here on behalf of New Democrats to support doctors, frontline healthcare providers, and most importantly, to support the patients of Ontario, because that's what you're doing here today. You're supporting patients. And that needs to be heard loud and clear. We don't want an austerity budget. We don't want to see cuts to our healthcare. We don't want to see cuts to our education. In fact, if we look at what the Liberal government's doing, they're not only cutting healthcare, they're cutting services for autistic children, they're cutting services for deaf and blind children. This seems to be one of the most careless, thoughtless governments I've ever seen, and it's really troubling to me. Anyways, I'm so honored to see you here today. This is what democracy looks like. All of you here together, making it loud and clear that you're standing up for patients, you're standing up for healthcare. I'm honored to stand with you as well. As a deputy leader for the New Democrats, and on behalf of our leader, Andrea Horvath, we stand with you on this struggle. Our health critic, Collins General, wanted to be here, but she wasn't able. But she's one of the strong advocates for you, the strong supporters. I'm honored to be here again. Thank you so much. Keep the fight going. We stand with you.
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ ਸਾਰੇ ਸਿੱਖ ਚੈਨਲ ਦੇਖਣ ਵਾਲਿਆਂ ਨੂੰ ਅੱਜ ਅਸੀਂ ਕੁਈਨਸ ਪਾਰਕ ਟੋਰਾਂਟੋ ਦੇ ਵਿੱਚ ਮਤਲਬ ਜਿਹੜੀ ਸਾਡੀ ਅੰਟੈਰੀਓ ਦੀ ਲੈਜਿਸਲੇਚਰ ਉੱਥੇ ਪਹੁੰਚੇ ਆ ਅੱਜ ਬਹੁਤ ਵੱਡਾ ਇਤਿਹਾਸਕ ਮਤਲਬ ਰੋਸ ਮੁਜ਼ਾਹਰਾ ਹੋਇਆ ਜਿੱਥੇ ਅੰਟੈਰੀਓ ਦੇ ਡਾਕਟਰਾਂ ਨੇ ਆ ਕੇ ਜਾ ਕੇ ਸਰਕਾਰ ਅੰਟੈਰੀਓ ਲਿਬਰਲ ਦੇ ਵਿਰੁੱਧ ਇਹਨਾਂ ਨੇ ਆ ਕੇ ਮੁਜ਼ਾਹਰਾ ਕੀਤਾ ਇਹ ਮੁਜ਼ਾਹਰਾ 20 ਸਾਲਾਂ ਬਾਅਦ ਇੰਨੀ ਦਲੇਰੀ ਨਾਲ ਇਹਨਾਂ ਨੇ ਕੀਤਾ ਅੱਜ ਸਾਡੇ ਨਾਲ ਮਤਲਬ ਇਹਨਾਂ ਦੇ ਮੁੱਖ ਆਰਗੇਨਾਈਜ਼ਰ ਆ ਡਾਕਟਰ ਐਂਡਰੂ ਲੂ Doctor, how are you today?
I'm excellent, thank you.
Doctor, successful event, successfully organized. Every politician from both parties, the NDP and the Conservatives came in big numbers. Jagmeet Singh, obviously 110% support. All the health critics were here. Many doctors were here from all different backgrounds. So where do we go from here now?
Thank you. This was an absolutely successful event. We came here today to send a message to Kathleen Wynne, to Eric Hoskins, that their cuts are absolutely unacceptable. To basically pay for their scandals and bureaucracy instead of funding healthcare is absolutely unacceptable. Today, we sent a message. We reached out to the people, to the media like yourselves, and to all corners of Ontario. And from here, we better send a message and they better listen, because we are more than willing to go back to the negotiating table and to actually negotiate fairly with doctors. But instead, they've done all this unilaterally, and hopefully they will take heed and listen to our message today.
So hundreds of doctors came. We saw the passion you're speaking through, right now, you're showing it, and a lot of the doctors are showing it. We had that, we walking down through Toronto, and the public was in your support today. How do you feel about that? Is the public on your side, or does the public understand your side of the story?
I think the public, slowly but surely, is certainly taking notice. have an outreach of 10 million on our Facebook group and growing. You know, we're all over social media and growing. We're 11,000 doctors strong, spreading this message. The public, as you can see here, is certainly supportive today. We certainly receive many positive comments. And these patients, these people, are votes. These are people who are up against the Liberal government. These patients do not support what the Liberals are doing. It's absolutely unacceptable. And from here, we certainly know we have patient support going forward and growing by the minute.
After the rally today, what's the next step? Your organizing committee, are you going to wait for other doctor feedback, or do you think the provincial government will reach out to you after the support that we saw here today?
Well, that's certainly the hope and the end goal. What we need from them is to commit to fair, binding arbitration and negotiation. No one wants to be here protesting these cuts, but it's at a point where we're in a crisis, where patients are dying on wait lists and ORs are being closed and clinics are being shut down. We need them back at the negotiating table, fairly, with binding arbitration, and to actually reverse the cuts that have caused so much chaos in Ontario.
So do you think from your rally today that the doctors across Ontario are going to be more motivated now, more unified as somebody has taken the 4 steps?
Absolutely, I agree. From today, it showed some solidarity, unity, people coming out to support us, both public, doctors, patients, you name it. Anyone who doesn't know, hasn't heard, will certainly hear the message now.
Why I ask that question is because previously it's been known that there's been fear-mongering, pressure on the doctors, pressure on certain unions not to protest or not to get organized. Do you have anything to say about that? Like how much truth to it is?
Absolutely. The Liberal government has done exactly that. Fear-mongering, threatening doctors, even going as far as saying, hey, you'll be removed from this hospital if you protest, that sort of thing. But at the end of the day, this is about patient care, and we're fighting for our patients. So I don't care what they do to me. I know that I'm standing up for my patients, my Ontario. And if they haven't heard the message yet, they'll hear it now.
My last question, Dr. Liu, is the comments from the Minister of Health, Dr. Hopkins. Do you think 2 days ago or yet what happened yesterday has sort of re-energized you guys, or do you think maybe he stepped his boundary a little bit too much?
Absolutely. What he did yesterday was all spin, lies, and distortion of the facts. What he did, knowing that we'd have a big rally today, was try to basically desperately divide and conquer, create some divisiveness within our profession, within our patients. But we know, as you can see here, the people of Ontario are not buying his lies and are not buying his spin. So going forward, the Liberals know that they're in deep water and they will not be able to keep lying to the people of Ontario. We have the facts, we have the hard data and the hard numbers to refute every single thing they say. And the people of Ontario know that.
Dr. Liu, your passion is awesome. In closing, if somebody, our viewers all around the world, would like to, give us your website or email, or how people can, of the South Asian diaspora, of the Sikh community, can get in touch, or get more knowledge about this issue.
Absolutely. You've seen what we can do today, but you can visit us on www.carenotcuts.ca. You can visit us on our public Facebook site, facebook.com/concernedOntarioDoctors. You can follow us on Twitter at OnCallForON. And you can also reach out to us at concernedOntarioDoctors@gmail.com. Multiple ways to get in touch. We'll see you at the next rally. We're going to keep on fighting. We're going to keep on going for the people of Ontario.
Thank you, Dr. Liu, and Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.
Thank you very much.
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. ਹੁਣ ਆਪਾਂ ਡਾਕਟਰ ਗਿੱਲ ਦੇ ਸਾਹਿਬ ਨਾਲ ਜਿਹੜੇ ਸਾਡੇ ਮੁੱਖ ਆਰਗੇਨਾਈਜ਼ਰ ਸੀਗੇ ਐਡੇ ਵੱਡੇ ਇਵੈਂਟ ਦੇ ਜਿਹੜੀ ਇਹ ਡਾਕਟਰਾਂ ਦੀ ਜਿਹੜੀ ਪ੍ਰੋਟੈਸਟ ਰੈਲੀ ਸੀਗੀ ਸਰਕਾਰ ਦੇ ਵਿਰੁੱਧ ਡਾਕਟਰ ਸਾਹਿਬ ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ
ਡਾਕਟਰ ਸਾਹਿਬ ਤੁਸੀਂ ਤੇ ਤੁਹਾਡੀ ਟੀਮ ਨੇ ਐਡਾ ਵੱਡਾ ਇਨੀਸ਼ੀਏਟਿਵ ਚੱਕਿਆ ਜਿਹੜਾ ਮਤਲਬ ਅੱਜ ਅੰਟੈਰੀਓ ਨੂੰ ਹਾਲਾਤ ਆ ਲਾਈਕ ਸਪੈਸ਼ਲੀ ਦੀ ਜਿਹੜੀ ਮੈਡੀਕਲ ਫੀਲਡ ਆ ਐਂਡ ਜਿੱਥੇ ਪੋਲੀਟੀਸ਼ੀਅਨ ਇੰਨੇ ਆਏ ਆ ਜਿੱਥੇ ਲੋਕ ਇੰਨੇ ਆਏ ਆ, ਇੰਨੇ ਪੇਸ਼ੈਂਟ ਵੀ ਤੇ ਪੋਲੀਟੀਸ਼ੀਅਨ ਵੀ ਤੇ ਡਾਕਟਰ ਵੀ, ਇੰਨੇ ਡਾਕਟਰ ਇਕੱਠੇ ਹੋਏ ਨਹੀਂ ਅਸੀਂ ਦੇਖੇ। ਆਈ ਥਿੰਕ 20 ਸਾਲ ਹੋ ਗਏ, ਆਈ ਥਿੰਕ ਜਿਹੜੀ ਲਾਸਟ ਮਤਲਬ ਕਿਸ ਨੇ ਪ੍ਰੋਟੈਸਟ ਰੈਲੀ ਕੀਤੀ ਸੀ, ਤੇ ਅੱਜ ਫਿਰ ਐਡੇ ਵੱਡੇ ਭਰਵਾਂ ਇਕੱਠ ਤੋਂ ਐਡਾ ਪੋਜ਼ਿਟਿਵ ਰਿਸਪਾਂਸ ਤੋਂ ਬਾਅਦ ਹੁਣ ਗਾਂ ਕੀ ਆਪਣਾ ਇਨੀਸ਼ੀਏਟਿਵ ਹੈ?
ਸੋ ਇਹ ਸਿਰਫ ਸਾਡੀ ਸ਼ੁਰੂਆਤ ਆ। ਇਹ ਅਸੀਂ ਪ੍ਰੈਸ਼ਰ ਪਾਈ ਜਾਣਾ ਲਿਬਰਲ ਗਵਰਨਮੈਂਟ ਦੇ ਉੱਪਰ, ਜਿੰਨਾ ਚਿਰ ਉਹ ਕਰਦੇ ਨਹੀਂ ਹੈਗੇ ਕਮਿਟ ਵੀ ਉਹਨਾਂ ਨੇ ਸਾਰੇ ਜਿਹੜੇ ਆਪਣੇ ਸਿਟੀਜ਼ਨ ਹੈਗੇ ਨੇ ontario ਵੀ ਉਹਨਾਂ ਦੀ ਹੈਲਥ ਕੇਅਰ ਫੰਡ ਕਰਨੀ ਆ।
ਡਾਕਟਰ ਸਾਹਿਬ, ਤੁਹਾਨੂੰ ਉਮੀਦ ਆ ਵੀ ਅੱਜ ਦੀ ਰੈਲੀ ਤੋਂ ਬਾਅਦ ਸਰਕਾਰ ਤੁਹਾਡੇ ਨਾਲ ਟੇਬਲ ਤੇ ਆ ਕੇ ਬੈਠੂਗੀ?
2 ਸਾਲ ਹੋ ਗਏ ਜਬ ਦੀ ਲਿਬਰਲ ਗਵਰਨਮੈਂਟ ਟੇਬਲ ਤੋਂ ਚਲੀ ਗਈ ਸੀਗੀ। ਡਾਕਟਰਾਂ ਕੋ ਕੋਈ ਕੰਟਰੈਕਟ ਨਹੀਂ ਹੈਗਾ 2 ਸਾਲ ਦੇ, ਤੇ ਇਹ 2 ਸਾਲ ਦੇ ਵਿੱਚ ਲਿਬਰਲ ਗਵਰਨਮੈਂਟ ਕੱਟ ਤੋਂ ਬਾਅਦ ਕੱਟ ਕਰੀ ਜਾਂਦੀ ਆ, ਤੇ ਸਾਨੂੰ ਉਮੀਦ ਹੈਗੀ ਆ ਉਹ ਵੀ ਵਾਪਸ ਟੇਬਲ ਤੇ ਆਉਣਗੇ, ਕਿਉਂਕਿ ਹੁਣ ਪੇਸ਼ੈਂਟ ਸਫਰ ਕਰਦੇ ਨੇ ਤੇ ਪੇਸ਼ੈਂਟ ਨੂੰ ਟ੍ਰੀਟਮੈਂਟ ਨਹੀਂ ਮਿਲਦੀ, ਪੇਸ਼ੈਂਟ ਵੇਟ ਲਿਸਟ ਤੇ ਮਰਦੇ ਨੇ। ਉਹ ਤੇ ਜੇ ਸਰਕਾਰ ਕੁਛ ਨਹੀਂ ਕਰੂਗੀ ਫਿਰ ਉਹ ਪੇਸ਼ੈਂਟ ਦਾ ਹੋਊਗਾ ਕੀ? ਹਾਂਜੀ।
ਅਗਲਾ ਆਪਣਾ ਪ੍ਰੋਜੈਕਟ ਕੀ ਹੋਗਾ ਅੱਜ ਰੈਲੀ ਤੋਂ ਬਾਅਦ?
Concerned Ontario Doctors the activist group ongoing ਆ। Okay, so ਅਸੀਂ ਹੈਗੇ ਆ 11,000 ਡਾਕਟਰ ਸਾਰੇ ਪ੍ਰੋਵਿੰਸ ਦੇ ਵਿੱਚ ਇਕੱਠੇ ਹੋਏ ਆ। ਅਸੀਂ ਸ਼ੁਰੂ ਕੀਤੀ ਸੀ ਕਿ ਗਰੁੱਪ ਸਪਟੈਂਬਰ ਦੇ ਵਿੱਚ, ਤੇ ਇਹ ਪਿਛਲੇ ਜਿਹੜੇ 6-8 ਮਹੀਨੇ ਦੇ ਵਿੱਚ ਸਾਡੀ ਸਪੋਰਟ ਪਬਲਿਕ ਦੇ ਵਿੱਚ ਗਰੋ ਹੋਈ ਜਾਂਦੀ ਹੈ, ਤੇ ਅਸੀਂ ਚਾਹੁੰਦੇ ਆ ਵੀ ਪਬਲਿਕ ਨੂੰ ਇਹ ਮੈਸੇਜ ਸੁਣੇ, ਕਿਉਂਕਿ ਇਹ ਅਲਟੀਮੇਟਲੀ ਪਬਲਿਕ ਨੂੰ ਇੰਪੈਕਟ ਪੈਣੀ ਹੈਗੀ ਹੈ। ਸੋ ਅਸੀਂ ਚਾਹੁੰਦੇ ਆ ਵੀ ਸਾਰੇ ਪਰਿਵਾਰਾਂ ਦੇ ਵਿੱਚ ਉਹ ਵੀ ਗੱਲਾਂ ਕਰੋ, ਉਹ ਵੀ ਹੈਲਥ ਕੇਅਰ ਦੇ ਵਿੱਚ ontario ਦੇ ਵਿੱਚ ਹੈਲਥ ਕੇਅਰ ਦੇ ਵਿੱਚ ਹੁੰਦਾ ਕੀ ਆ।
ਡਾਕਟਰ ਸਾਹਿਬ, ਤੁਹਾਡਾ ਜਿਹੜਾ ਵੈਬਸਾਈਟ ਆ ਜਾਂ ਜਿਹੜੇ ਆਪਣੇ ਘਰੇ ਬੈਠੇ ਜਿਹੜੇ ਦਰਸ਼ਕਾਂ ਦੇਖਣ ਵਾਲੇ, ਖਾਸ ਕਰਕੇ ਆਪਣੇ ਸਿੱਖ ਪੰਜਾਬੀ ਕਮਿਊਨਿਟੀ ਦੇ ਵਿੱਚ, ਉਹ ਕਈ ਵਾਰੀ ਉਹਨਾਂ ਕੋਲ ਉਹ ਇਨਫੋਰਮੇਸ਼ਨ ਨਹੀਂ ਹੁੰਦੀ, ਜੇ ਹੁਣ ਤੁਹਾਡੇ ਐਡੇ ਵੱਡੇ ਇਨੀਸ਼ੀਏਟਿਵ ਬਾਰੇ ਜਾਂ ਇੰਨੀਆਂ ਕੱਟਾਂ ਬਾਰੇ ਜੋ ਸਰਕਾਰ ਕਰ ਰਹੀ ਹੈ ਉਹਦੇ ਬਾਰੇ ਉਹਨਾਂ ਨੂੰ ਕੋਈ ਜਾਣਕਾਰੀ ਹੈਗੀ ਹੈ?
ਜੀ, ਸਾਡੀ ਹੈਗੀ ਆ ਵੈਬਸਾਈਟ care not cuts, ਸੋ www.carenotcuts.ca, ਤੇ ਸਾਡੇ ਕੋਲ ਫੇਸਬੁੱਕ ਪੇਜ ਵੀ ਹੈਗਾ, we are your Ontario doctors, so facebook.com concerned Ontario doctors, ਨਾਲੇ ਅਸੀਂ ਟਵਿੱਟਰ ਤੇ ਵੀ ਹੈਗੇ ਆ on call for on।
ਡਾਕਟਰ ਸਾਹਿਬ, ਸਾਡੇ ਵੱਲੋਂ ਤੇ ਸਾਡੇ ਸਿੱਖ ਚੈਨਲ ਵੱਲੋਂ ਤੁਹਾਨੂੰ ਬਹੁਤ ਵਧਾਈਆਂ, ਜਿਹੜਾ ਐਡਾ ਵੱਡਾ ਤੁਸੀਂ ਭਰਵਾਂ ਇਕੱਠ ਕੀਤਾ, ਤੇ ਅੰਤ ਦੇ ਵਿੱਚ ਅਸੀਂ ਵੀ ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਤੇ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ।
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ।